ಗುಡ್ ಮಾರ್ನಿಂಗ್, ಎಲ್ಲರೂ ಹೇಗಿದ್ದೀರಾ? ಯಾರೆಲ್ಲ ನನ್ನ ಚಾನಲ್ನ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿಲ್ಲ, ಗೋ ಆ್ಯಂಡ್ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮೈ ಚಾನಲ್. Today onwards, I am started new conditions, mainly that is a pediatric based on this system. Today I will discuss with the congenital cardiac disease. Congenital abnormality means by birth only children are having some conditions. Here what will happen? Based on the system, some conditions are there. In that, today we will discuss regarding the congenital cardiac anomalies. That is a atrial septal defect. See, this is a atrial septal condition. We are also calling as what another name is a ASD. In a short form, we are calling ASD. Understood? This is a normal heart structure. This is a normal heart structure. In this condition, what happened? There is a abnormal opening in the septum between the atria. Understood? There is a abnormal opening in the septum between the atria. Means this is a heart structure. You are seeing this is abnormal structure. Here you are seeing a hole. Hole means there is a opening between the atria and septum. This is a septum. This is divides the both ventricles and atriums of the right and left side of the both chambers. What will happen? Here there is an abnormal opening in the atrium and septum. Due to this opening, this deoxygenated blood and oxygenated blood will be mixed up with these both chambers. Understood? What will happen? Due to this opening, this deoxygenated blood and oxygenated blood will be mixed up with both chambers. That time what will happen? These both ventricles, this right atrium and left ventricles are passing the oxygenated blood to the aorta. With the help of aorta, whole part of the body will get the oxygenated blood. This is a normal structure. But what will happen now here in this condition? So when this right atrium and left atrium blood will be mixed up with the iota, that time our body will not get means children will not get a sufficient oxygenated blood. Understood? What will happen? Children will not get discussing regarding some causes. Why it will happen means due to any genetic factors like family history of congenital heart diseases and genetic syndromes such as Down syndrome, sometimes abnormal chromosomal defect. This type of genetic factors will be causing to the fetus during the pregnancy. Understood? If they are not getting a sufficient antenatal care means this type of condition will be occurring after the birth of the children. Next, environmental factors. Environmental factor means what? During the pregnancy, mothers will have some rubella, some urinary tract infections. This type of infections also getting the water. This type of conditions. Next, exposed to the alcohol, smoking, certain medications during the pregnancy. This is also one cause of these conditions. If the mother is not maintaining her health in a proper way, means like if she is taking alcohol, smoking, any certain drugs like heroin, cocaine, this type of drugs will be mainly affecting to the fetal development. Understood? Next, other teratogenic factors during the fetal development. These are the some causes. Next one, let's start some signs and symptoms. Means after having this type of the conditions, means already there is an opening in the atrium and septum. See, there is already an opening between the atrium and septum. This is a opening. There is opening between the right atrium and left atrium. What will happen when there is a mix up with the both blood, the oxygenated and oxygenated blood? That time there is no proper supply of the oxygenated blood to the body. What will happen? Due to that, there will be due to that time children will not get a sufficient oxygen. Understood? That time like a dyspnea, fatigue may be occur. Sometimes what will happen now? Due to there is a mix up of diagnostic evaluations. Diagnostic evaluation means what? How we are identifying this is a atrial septal defect. By doing some examination, we can identify yes, this is this condition. Understood? By physical examination, we can do the we can identify the conditions or we can determine the conditions. Mainly physical examination, we will with the help of stethoscope we will hear the heart murmur sound. Next, echocardiogram. Echocardiogram is like ECG. In that they will see the electrical impulses and electrical activity of the heart and heart rhythm of the heart. Next one is chest X-ray. Chest X-ray, by doing the chest X-ray we can see the abnormal structure of the heart, which part is getting a damage, means in which position, which place having a damage like a hole. Understood? Next one, electrocardiogram. Electrocardiogram means what? ECG. By doing ECG, we will get to know the detailed activity of the heart. Next, cardiac MRI. Cardiac MRI, with the help of the cardiac MRI, we will completely determine the abnormal structure of the heart and position size of the heart. Next one, cardiac catheterization. Cardiac catheterization mainly to confirm the diagnosis and measure the pressure in the heart chambers. Means by doing the cardiac catheterization, we can identify any blockages of the atria and aorta. These are the some diagnostic evaluations of the atrial septal. Means what? Sometimes they will go for what medical management and surgical management. Medical management means by providing or by administering the some medications we can treat the some conditions, and surgical management means what, based on the severity of the condition we can perform the surgery. After performing the surgery we can cure or we can. In medical management mainly diuretics and inhibitors are prescribed by the heart failure. Diuretics by mainly like furosemide, Lasix, these are the example for the diuretics. In children a small amount or a small dosage of the medications will be administered for the children. Next one, AC inhibitors are the atenolol, propranolol, these are the example for the AC inhibitors. Mainly it will prevent the heart failures. Understood. Next, anticoagulants. Anticoagulants, these are the risk for the, it will prevent the risk for the atrial arrhythmias or any strokes. Anticoagulants like varaparin, heparin, these are the some examples for the medical management. Next one, surgical management. In surgical management, they will do the surgery, means open heart surgery may be necessary for the very large ASD for the transcatheter closure is not feasible. The surgeon will close the opening with a patch or the sutures.